Introducing Laura, James and Abigail from Methley. How does it feel for me? March 2023. Can you introduce James, Abigail and yourself?
I'm Laura. I have 2 children. I have a daughter, Abigail, who's 10, and I have a son who's called James and he's 6. James has really complex medical needs. He is non-verbal, he doesn't eat, he has 3 different types of seizures, has a heart defect, lots of different things going on. And also my daughter has quite high levels of kind of social anxiety. So we live on the borders of Leeds and Wakefield. We currently live in Methley.
What do James and Abigail enjoy doing?
Abigail, she really enjoys reading. James loves cars, loves being outside on the bike and playing. We also have a dog and he absolutely loves the dog to bits as he loves animals.
Can you tell us a bit about James's health conditions and how they impact on his life?
So James was born 6 weeks early. We found out during the scans that he was going to be born with a heart defect which would need lots of open heart surgeries. But since he's been born, it's now become sort of apparent that there's lots of other health needs. So he has a moderate to severe hearing loss, which he has to wear a hearing aid for. He has issues with controlling his eyes, so he gets like a double vision. He has 3 different sorts of seizures, so they are currently not controlled by drugs. So we're trying to come up with a plan of how to control those for him. He has got an issue with his jaw, which means he can't open his jaw. He is nil by mouth because of an unsafe swallow. And I give him blended diet, blended food through his button. And he is also really wobbly on his feet. We've had genetic testing and it's shown that he has got a genetic condition, but he's only the 3rd child in the world that's got this.
How do James's health conditions impact on you and your family's life?
I worked full time before James and I did try to go back to work after I'd had James, but it wasn't an option. So I went back to work for about a month and just had to hand in my notice because it wasn't working for like my own mental health as well as the needs of the family. So that means we're now down to a 1 income household, which is quite hard. It restricts what we can do as a family and the nice little treats that you can have. And also we can't really do what we want to do because of James's needs. So sort of going out for a meal, which you would do as a family, we don't feel that that's particularly fair on James because he can't eat. So we do have to adapt what we do as a family, which then makes Abigail a little bit sort of resentful that we're not doing what her friends are doing.
Why did you decide to take part in this project?
I decided to take part because we have been involved in lots of different services because of James's health needs, lots of different areas within Leeds, but then also within Wakefield and Sheffield as well. And I just feel that it's a really good opportunity to help health professionals learn what they do and say and how that impacts us as a family.
Thank you to Laura for sharing her family's story. Produced by Health Watch Leeds in collaboration with Axinia Yakovleva.